Hi guys, hope you're doing good today. Thank you so much for tuning in to You Report with Miss J. Alright guys, I'm going to go ahead and get started. I'm going to be talking about some of the updates that I've seen the past few days regarding coronavirus. I'm going to start here um, uh, with my reference page that I definitely refer to as far as they give a pretty good case summary of the cases, um, the current cases throughout the United States. So I'm going to start off here I'm at 1.3acres.com. So they have a total count so far of 42,373 confirmed cases in the United States, 572 deaths, unfortunately, and 178 recovered. They also have, for Canada, 2,035 confirmed cases, which I believe is a pretty big jump from what I've seen the past couple of days. They haven't been really going up too much until really a few days ago. All of a sudden, they're going up pretty quick. So, and they also have 25 deaths and 109 recovered. So just wanted to just talk about some of the things that I've seen. I'll go to my Twitter page because I have been posting. I've been posting a lot past couple of days on my Twitter page, and also, there's a lot of people that have been posting some really good information out there. So I will, definitely retweet those things that I think, or I think will be really good information. And of course, as you can see, I think I last tweeted about an hour, just a little less than an hour ago. This was from globalnews.ca. Coronavirus premier to outline BC's financial stimulus package. So they are evidently offering a stimulus package, in the British Columbia area. So I just thought that was quite interesting. I'm not sure how their votes and all that kind of stuff work. I don't know if it automatically passes. I'm not sure. To be provided to. Yeah, so I'm not sure how that works. If it's already passed, that I'm not sure of. But you can see here they are proposing a one-time $1,000 tax-free benefit for British Columbians unable to work due to the crisis. They also offer, let's see, it says in order to be eligible for the benefit, applicants must be eligible for the federal care benefit and employment insurance. So you can't just get it, you have to meet the requirements to receive that particular help that they're going to offer in British Columbia. So I just thought that was interesting. And the reason I thought that was interesting is because of what we got going on in the United States. I mean, again, I believe the bill once again failed in the Congress. So, here we are again with no assistance to all the people that are affected by this that no longer can work right now. So I just thought it was just crazy. How, we being the United States of America, why is it that we can't just help the people that need help? What in the world? What are you guys waiting on? I mean, you can see, look in New York. Look what's going on in New York. Do you want to see what's going on in New York? Okay. Let me show you. Let me show you. Let me just show you just in case. New York has 20,875 confirmed cases. Okay? That is the whole state of New York. I'm just saying, why not help all these people, not just in New York, all through the United States? Why does it have to be all the political, oh, this and that and this and that? Come on, people need help. People are not able to work right now because of this pandemic. But you guys, whoever you are in in the House of Representatives and the Senate, choose to fight amongst one another when people need help. People need to know how they're going to pay their bills while they're out of work. How are they going to feed their children while they're out of work? Hello? I'm just saying. Oh, I don't understand. I don't get it. I really don't understand. I don't get it. I don't get it. Look, if the policymakers and the voter, the House and the Senate, look, if you guys can just find everything that you do agree on, how about that? Let's start with that. Let's start with everything you do agree with, okay? And write down, get somebody to type up everything you do agree with, okay? And make it official and pass that. If that will get the ball rolling to get people help. And then everything you don't agree with, work that out later. People need help right now. Y'all tripping. Come on. What are y'all waiting on? You waiting on the count to go even higher? It's ridiculous. It's just ridiculous. I don't understand it. I don't get it. I just don't get it. Ugh. Okay. Moving right along. Yeah, so these are some of the tweets that I sent out today. So since I'm in the North Carolina area, and I'm not gonna spend this live just strictly talking about North Carolina, but I do want to give some updates. So for anybody that is in the North Carolina area, according to the update that Governor Roy Cooper did earlier, several hours ago, just to let you know, if you do have children, public schools will remain closed through May the 15th. Okay? All right, guys? May the 15th. All right. And of course, you can see I'm on my Twitter page. So if you want the link, definitely click on my Twitter page and you'll see the link. My Twitter account is at YouReport with Miss J, by the way. So you can see that right there. They also mentioned, they also said all gyms, movie theaters, health clubs, hair and nail salons, barbershops, and massage therapists must close their businesses beginning at 5 p.m. on Wednesday, March the 25th. Okay? So for all of you that applies to in the North Carolina area, please be aware. All right, guys. So let's see. And I'm just going over some of the things that I retweeted or tweeted just today. Yeah, people are pretty upset with the stimulus package not passing. It's ridiculous. I just don't understand it. I think, that's my comment I posted. I said, well, this is to, um, it says coronavirus stimulus talks hit setback as crisis deepens. Again, this was way before they even voted again. And for those who don't know, it didn't pass again. Okay, so they're still going back and forth, trying to decide what package is going to work best. Oh, come on, dude. People need help. So my comment was, what is the problem? People need help now. And every minute spent bickering over a stimulus package that will help those in need will have, I think, dire consequences. Ugh. Right. Ugh. Ugh. It's crazy. Unbelievable. Um, yeah. Secret Service employee tests positive. That is from CBSNews.com. This thing is just crazy, 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 crazy. And another cruise ship. Another cruise ship. Has 42 passengers on it. All right. Now another cruise ship. All right. Another cruise ship with many that have tested positive for COVID-19. See, I need to change that. Because when you pull up the report, I need to change that. I may need to delete that because it says a cruise ship is still trying to get passengers to port. Now 42 people on board are sick. It says they're sick with flu-like symptoms. Yeah, so I'm going to have to delete that. I don't want to put that up there and they're not positive for COVID-19. I hope they're not. But I tell you, I hope they're testing them. I hope they're testing them. It's a ship that has 1,829 people on it. 1,243 guests and 586 crew members on board. It's crazy. Crazy, 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 crazy. And they still have ships out there. I mean, there's still a lot of ships out there. They're still out in the water because they can't dock because, nobody wants them to dock near their area because of the pandemic that's going on. So, my question is, what kind of fail-safe do y'all have in place? What kind of emergency, procedures do you guys have in place as far as cruise ships? And if it's an emergency that happens while you're on the cruise, what do you have in place? You got to have something in place. You got to have, come on now. Surely you guys have something in place. I don't understand it. I don't understand. I'm going to tell you something else I don't understand, okay? Something I thought about earlier. Okay, so I believe the first case was officially, in the United States, the first case was around January the 21st, I believe. Oh, wow, I didn't even see that. Did y'all see this? Wuhan evacuee. They got, see, that's why I like this website. Wow, I didn't even know they had that on here. I guess they must have just added that because I'm on here every day. Yeah, but I think the first case in the United States, I believe, was in January, I think. I'm going to try to go to the last page, see if I can get the first case pulled up. Yeah, right there. January 21st was the first case officially in the United States. So, the reason I mention that is, why wasn't there enough done to prepare for this? Shouldn't there have been okay, we got the first case in Washington State. Okay, we got a couple of hundred cases in, Washington State, now passing to California and the surrounding areas, and okay, there's a new case in New York. Okay, now there's hundreds of cases in New York. Why wasn't anything done? What in the world? Why was there no preparation done within the healthcare facilities? I'm just not understanding. I don't understand. What do? Wait until things get worse before you start acting out and before you start doing stuff? You wait until it hits your state, until it gets to a certain number before you start doing more than just telling people to cover their cough and cover their mouth, cover when they sneeze and stuff. You gotta do more than that. That's crazy. That's crazy. I don't get it. At what point, and of course it's up to each state to determine what they should do. It's not up to the government. It's up to each state regarding the United States. But what are the states waiting on? I know a lot of them are doing a lot. They really are. But some of these states are it's like they're waiting. It's like they're waiting on the numbers to go higher before they act. Come on, people are dying. People are suffering. People are in hospitals. People are in their homes for weeks and weeks at a time. What are they doing? What are they waiting on? I don't get it. Is it a certain number that they have to get to before they do more? I'm not saying everybody, no, nobody wants to be quarantined for 2 or 3 weeks. I'm just saying nobody wants that. But if it was a choice between being quarantined for 2 or 3 weeks as opposed to letting everybody pretty much do what they want to do and the virus spreading even more, which one would you pick? I'm just saying, what are these guys waiting on? I don't get it. I just don't get it. And it's like they're doing stuff in steps. Okay, so first you get the everybody wash your hands and cover your mouth when you cough or sneeze, and practice social distancing. Okay, that's good advice. However, you still got people. Just this past Saturday, over 100 people at a Lowe's in the city that I live in. Lowe's, guys, Lowe's. Not a restaurant, not a amusement park. I'm just saying Lowe's. I know it was over 100 people in there. I mean, the people were just packed in there. How is that making anything better? Nobody was in there with gloves or mask on. I did not see anybody in there spraying disinfectant on anything. You know good and well, if you go into Lowe's or any of these other home improvement places, ain't nobody going to each of the items and spraying and cleaning off everything that everybody touches. Come on. That's not happening. So my point of saying that is, yes, you do the social distancing and tell people to cover up when they cough and sneeze, but I'm sorry, that's just not enough. That's not enough to contain or to stop. I'm not contain, but to stop the spread. The whole point of it is to stop the spread of the virus. in order to stop the spread. No, I'm not a healthcare worker. I'm not a professional, but it don't take a rocket scientist to know that to stop the spread of something, you stop the exposure to other people. Hello? Hello? I'm just saying. I know I'm not the only one that knows this, but I'm just saying. I'm just saying. What is it going to take? It shouldn't take more people to get infected with this virus for more states to do more. All right, moving right along. My next question. I got another question for you. Okay? Next question. And it goes kind of right along with what I was just talking about. So, and this is just not in North Carolina, but I'm using North Carolina just because that is where I am right now. And I got a question. All right, hold on. I'm gonna show you my question. So I want to know. I want to know. I'll find it. It's in here because I'm telling you, I've been posting a whole lot today. I seen a report that some of our healthcare officials, and I know you guys have seen this too, some of the healthcare officials do not have enough, they don't have enough supplies. How do you not have, how? When I say supplies, I'm talking about basic supplies. I ain't even talking about major equipment that needs to be ordered and all this kind of crap. I'm talking about basic supplies. Face masks, gloves. People. These are the people that they're really on the front line. They are on the front line. They are the ones trying to take care of the people that come in there that are sick and that are feeling bad and that are already scared because they're thinking that they possibly could have this dang on virus. You mean to tell me, look at this. Drive-through testing sites pop up across North Carolina, but supply shortages cause some of them to close. Really? They just opened up. They literally just opened up. This report is from today, from NorthCarolinaHealthNews.org. They just opened up, but they already have to shut down because they don't have enough supplies. That is just ridiculous to me. I don't get it. I really don't get it. I don't get it. I don't get it. I just don't understand. And it's happening all across the United States. And definitely look in New York. I mean, New York is, oh my gosh, they are really struggling right now. They don't even have enough supplies to help the people that's coming in there for help. It's ridiculous. This is another report from North Carolina. All right, look at this. This is from NorthCarolinaHealthNews.org. Okay. No, that's not the one. Oh, that might have been the same report, but oh, there it is. That's what I wanted to show you guys. The national shortage of personal protective equipment is showing itself in North Carolina, with hospital systems in the state already asking for public donations of gloves and masks. Really? Okay, look at this. UNC is even accepting handmade masks out of tightly woven cotton. Dude, really? Really? At this critical time, we are calling on our community to donate supplies that will help ensure we can continue to protect our patients, providers, and staff, said Dr. Wesley Burks, CEO of UNC Health, in a statement. This situation is unprecedented, and we are asking for extra help. Okay, y'all ready for my next question? Why? Why? I'm just saying. I'm just saying. When we heard about this virus spreading around in China, everybody was just like, well, a lot of people were like, oh my goodness, that's horrible. I hope they get a handle on it. I hope it, you know, we were hoping for the best, of course. A lot of us were. Okay. And then we seen it spread into other countries. And then it started here in the United States. Okay. Once it got here in the United States, didn't somebody think to, uh, you know what about the hospitals? What about our healthcare, facilities? Maybe we need to look at what kind of protocol we have in place for an emergency situation like that. Not saying that it would happen here in the United States like it had happened in China, but maybe we should prepare just in case it does. Did nobody think about that? I'm just saying. I don't understand. I just don't. I don't get it. I don't get it. I don't get it. So those are some of my questions. Uh, some of my questions so far. Also, seen this post from KTLA.com. It was saying an inmate at state prison in Lancaster test positive for COVID-19. And that made me think about all those that maybe have, family members, loved ones, friends that are incarcerated or that work in the prison system or the jails or, places like that. So you guys may want to look up those particular places where they are or where they work and just see what kind of things they have in place for them. Just something to kind of keep in mind. Yeah, just crazy. Crazy, crazy, crazy. Let me do a quick update. Twitter page. Because there's so much going on. I'm not going to stay on here too much longer. I just pretty much wanted to test my sound and stuff out on here as far as my live is and see how it picks up. Let's see what you guys are talking about. Yeah, so UK Minister, South Africa. Yeah, I don't want to post stuff that I don't have links to. I try to kind of stay away from those. I will look at it, but if it looks like something I want to look at, then I'll search for the link. But if it doesn't have a link, I try not to bother with it. B&O is pretty good. They have a pretty good website. They're pretty good at updating stuff. But also, again, I don't like to pull up stuff if I don't see a link. But yeah. So that's just a little few questions that I have for you guys. Hopefully somebody can answer me. Alright guys, so I'm gonna get off of here. Just wanted to do a quick live just to give you guys a quick update, and I'll just end with, let me just go ahead and do another refresher. So the count as of now in the United States is 42,657 confirmed cases with 575 deaths in the United States, as well as 2,035 cases in Canada, 25 deaths, and 109 recovered. Alright guys, so hopefully you got a little bit of information from this live. If you have any concerns or questions, views or suggestions, by all means hit me up on my Twitter page at YouReport with Miss J. Alright guys, you take care. Remember, your voice matters too.